This is Karol Sikora here, talking about life after COVID. The pandemic will come to an end. We can be assured of that. The numbers are going down, and because testing is going up, they're not going down as fast as you'd imagine, but we're definitely coming off the plateau. The number of hospitalizations is dropping. The NHS has coped really well with that because of forward planning. And then the deaths are coming down. So we're coming out of it now. The decision that has to be made is when to get us out of this complete mess we're in, the lockdown. Other countries have already begun the process. So we've got a lot of information to gather from Austria that began exactly a week ago today. How do we do it? We do it gradually. We don't just all suddenly put the lights on in Piccadilly and just march and drink champagne on the streets. It's got to be a slow process, beginning by opening the small shops and businesses, maybe defined by less than 50 employees. We've already got the supermarkets open. Why not DIY? Why not garden centres? Moving down to small cafes where you can keep at least a metre apart. We have to find out if we can do a metre separation, because that would make it logistically much easier rather than 2 meters. And then let's move on, bigger shops, smaller offices, and then get everything back to work. What's remarkable is the transport's run throughout. I'm classified as an essential worker, and I can come into London on the train. I get a carriage to myself. Yesterday I had a train to myself. I talked to the engine driver. He was quite a chatty chap. As we move forward, all sorts of strange things will happen out there, but we have to get moving just for the sake of the people and the economy. Now, the encouraging thing in Austria already, we've been going 7 days, there's no increase in infection, there's no second wave. There wasn't a second wave in Korea, Singapore, or China. What we did see was returning migrants that were positive were arriving and becoming ill. So there were some new cases, but that wasn't due to the endogenous population. So we just need to monitor people that are coming back from abroad and make sure they understand they have to isolate. The problem with this virus is we're not sure when it's going to end completely. What will it be like in Britain in October of this year? I'd like to think it would be business as usual, normal. We wouldn't cross the street when we saw someone coming along and so on. I have no way of predicting this, to be honest. And it really depends how things behave in this country, not people, how the virus behaves. These viruses can mutate, and we're not going to have a vaccine this year, despite the positive newspaper reports. People are working on it, tremendous effort, I don't decry it. But the logistics of immunizing even half of the population, that's 33 million people, with a validated vaccine, measuring that they actually are immune by checking their antibody levels 3 weeks later before we give them a certificate of vaccination, is one big logistic exercise. And we know that Public Health England have failed us on testing using polymerase chain reaction already. So why would they do any better with this? We need to smarten up our logistics for testing in this country badly. Matt Hancock's 100,000 tests a day by the end of this month. If you look at the curve, it's at about 20,000, and most of that's hospital-based. So we need community projects to understand the prevalence, that's the number of people that are living with this virus.